Way to go, Johnny. Okay, I want to introduce you a new guest to City Line, and this is Dr. Lisa Kellett, Director of Dermatology for SpaMedicaTV. So let's hear it for Lisa Kellett. The doctor is in. The doctors are getting younger as I get older. We're going to talk about skin and you know, women and acne, adult acne. Getting a lot of complaints about that. Thinking that after you finish your teenagehood, and then you get into your 20s and 30s, everything's okay. I see here women about getting pregnant and they get really bad acne. So what's your take on that? What can we do? Because it's...
Yeah, well, adult acne is on the increase.
It is.
And it's probably multifactorial. It's probably stress, in addition to hormones, our environment. And then finally, I think a lot of adult acne is actually what we do to ourselves, the products that we use. Remember that adults, women, as they get older, they generally use anti-aging products, and the anti-aging products are oil-based.
And so that clogs everything up.
So it's probably what we're doing to ourselves as well.
Okay, okay.
So I tell people, you know, very simple, very cheap, start with what you're using. And get rid of everything that is oil-based. Now, a little hint.
Okay.
Cosmetic companies will say that something is water-based if it's 49% oil and 51% water, which is not my definition of water-based. So look for things that are water-based rather than oil-free.
Okay, so that'll help us along the way. Now, I'm suffering from a little bit of a cold today. Sorry about that. Let's talk about when the hormones. The hormones are, is that really the major cause of acne in most adults?
It probably is to some extent, but as I said, I think most of it is probably multifactorial. It's a number of factors.
Okay, what about areas of acne? All of us have had or have probably seen it on television, like facials, and they say, you know, sometimes I get breakouts along the jawline, and they go, well, that's your intestinal tract. It's angry with you right now. It's under a lot of stress. I'm thinking, when is it not angry with me? Or you get along here, or where your glasses are. I mean, a section is where you get acne. Is that really describe another part of your body?
You know what? Adolescents get acne in the T-zone.
Yes.
But as we age, we get acne in different zones. And usually, as people get older, they get it along the jawline, in the jaw, along the temples. Do we know why? No, it probably has to do with the distribution of sebaceous glands, of oil glands.
Okay.
And which ones are activated.
Now, if you had acne as a teenager and it left some scarring, there's been great technological innovations.
There's a lot that can be done.
Yeah.
Historically, dermabrasion used to be done. The problem was that it caused a lot of scarring and a lot of downtime.
Right.
Then it went into something called CO2 resurfacing, which is a laser that's used to resurface. Once again, that's quite a bit of downtime. You're looking at 4 weeks. The newest thing is something called an erbium peel. It's 1 week of downtime.
Really? So what happens?
So what happens is we use a laser, the same laser that we would use for resurfacing. But what we said is, well, we can use this for resurfacing, or we can turn it down. So instead of 4 weeks of downtime, you get a week of downtime.
Okay.
And you get it looks like a bad sunburn for about 3 days. Then you get some brown flaking, and then by 7 days, you're fine.
What about, do any of you out there, and if you don't want to be honest, you can't, you're like under the age of 16, so don't even answer this one, okay? Little red lines on our skin. What is that hormone? What is that? Little veins?
Those are something called telangiectasia, or spider veins.
Do you have them? Anybody? Okay. Okay, fine. You don't in the front row. I don't believe them. What is that? What is that?
You know what? It's probably a form of what we call rosacea, or broken blood vessels. Once again, as we age, the skin gets thinner. There is a great treatment now for that. And it's something called a VersaPulse laser.
Oh,
and it is so nice because historically the lasers that we used to leave bruising. People would have 10 days, 2 days of bruising.
So you know that you wouldn't have some work done on it.
Now we have a new laser. You come into the office, we treat them, and that's it. They're gone. A little bit red after.
One shot, you're done?
One shot deal.
You are kidding me.
85% of the time, one shot deal.
Are more men coming to see somebody like you, Lisa?
I see quite a few men.
And what are their major complaints?
You know what? They actually don't want to look 20 years younger. Their major complaint is that they look tired. They'll be well rested, they'll go into a business meeting, and people will say, oh, you look tired. And they're not tired, they find it very frustrating. So that's the major complaint that men have.
Let's talk about rosacea. You mentioned that. A lot of people do suffer from it, different levels of it. Tell us what it is and what you do. It's not just that.
Right. Rosacea, it's like a spectrum of disease, and it's basically a disorder of blood vessels and sebaceous glands.
Is it hereditary?
It's hereditary in that if you are of Celtic origin, if you have very fair skin, you're more predisposed to getting it.
Oh, okay.
And it can be very mild. Princess Diana had rosacea. She had a very mild form.
Okay.
And the W.C. Fields or Bill Clinton with the bulbous nose, they also had rosacea. Now, just because you start with a very mild case doesn't mean you're going to go on to have a severe case of rosacea. In terms of treatments, there are topical treatments that are available, anti-inflammatory creams and gels. In addition, some people actually get some bumps and pustules and papules with it, and then we use oral antibiotics for that. And then finally, lasers are the newest thing, the treatment for rosacea. So we can decrease the flushing and the blushing, the red spots,
What
the
does
spider
it do?
veins.
What does it do? When the laser goes in, it just kind of breaks up the...
You know what it does? It
No.
targets blood vessels. So it's looking for what we call a chromophore, a target.
Okay.
It's targeting blood vessels. It heats up that blood vessel so much that it closes it off.
So
And
then
that's
there's
how it
no
works.
red. So there's no red AIDS. Okay, now
Yeah.
does rosacea happen when you're a child? Does it start to formulate as a teenager?
Yeah, usually after the age of 25. You see some very mild flushing and blushing, and then after that time it goes on to progress.
More in women than in men?
You know what? It's fairly commonly distributed.
Is that right?
Yeah.
Okay. If you did not, let's go back to the acne thing. If you did not have acne as a child, would you? Does that mean that you won't have as an
You know
adult?
what? The interesting thing about adult acne is that a lot of people who don't have acne as teenagers will get adult acne. And it's very frustrating because their face will be fairly clear during adolescence, and then they'll become an adult, and it's frustrating for them because they suddenly get acne.
To some of us, it's payback. To some of us, it's payback. However, I had acne as a high school student and then again as an adult, which brings me to cleansers. You know, we talked about moisturizers and things like that, but some people, when you are dealing with something that an irritant on your skin, whether it be a pimple or something else, you know, we always hear about exfoliating. That irritates the skin, does it not?
It does. I tell people if it hurts and it makes you red, it's not good for your skin.
That's just a great thing to
that is your
remember.
skin's response to injury. Listen to your skin. Don't listen to someone who's getting at a cosmetic counter. Listen to your own skin. You know your skin best. So if something is irritating your skin, stop it.
Okay. Now, when you are using something and it seems, okay, did you want to know about this? I did. Does your skin get tired of the same stuff you use on your face? Does it rebel after a while?
It can, but
Like
you have
cleansers, moisturizers, those types of things?
It can, but you have to remember that your skin is not static. It doesn't stay the same.
Right.
It changes with weather. It changes with stress. It changes at certain times of the month. So your skin is not static. It can change.
Okay.
So a product that might be good for example, for the summertime, like a cleansing bar or soap,
Yes.
is not great for the wintertime because your skin is drier. So you have to change to something like a cleansing gel.
Besides staying out of the sun, we all know we have to do that. You wanted us to wear, what's an SPF that no lower than 30
You know
on the
what?
face?
No-
or I
no-
know you guys do 45 on the face,
Yeah,
so
absolutely no lower than 15.
no lower than 50.
However, the newest thing now is instead of looking at the number, look for what's in it. Look for physical blocks like titanium dioxide or zinc oxide,
Okay.
rather than the number.
Okay.
And usually those are usually 30 or higher anyways.
All right. And then besides that, what else do you want us to know? Like water? You want us to drink a lot of water?
You know, I tell people what you take in will reflect on your skin.
Right.
Okay, lots of water, a good diet, fruits and vegetables.
And does it matter how many times you wash your face during the day? A lot of people are very, you know, they want to wash their face like more than...
You know what?
The
Twice
natural oils.
is more than enough.
Okay.
Another hint that everyone forgets.
Yes.
When you wash your face, wait about half an hour before you put your moisturizer on.
Why?
Because that will give your natural oils time to come back to your face. And I tell people that a lot. Wash your face and wait. Go to the mirror half an hour later and then decide if you need a moisturizer or not. And a lot of people at that point in time, especially women with acne, will be oily already in the T-zone. So obviously they don't need a moisturizer there.
Okay, so do you have any product recommendations for us on any like cleansers or things like that?
You know what? A great cleanser is something called Cetaphil
Yeah,
or
I use that.
Spectrogel.
Yeah.
They're very mild, they're cheap, and they work well.
Well, they're cheap if, you know, some drugstores have it on sale. If you know what I mean? He's not listening, so it doesn't really matter. He's not listening. That's okay, Derek. And toner, is it necessary for us to have toner?
It's not absolutely necessary. It depends on what your skin is like. If you have an oilier skin, then a toner would be helpful. If you have a drier skin or an aging skin, you may not need it at all.
Because you're a dermatologist, should you really wait for a problem before you go see somebody like you? Or should we do like we do when we see our GP, that you go and get checked every once in a while, just for, you know, like freckles or,
Yeah.
you know, any changes in your
Yeah,
skin?
everyone should check their skin once a month, looking for any new changes or new moles. However, it is useful to see someone about once a year for a check, especially areas you can't see, like your back.
Yeah.
You want to get someone
So
to
you
take
just
a
do a
look.
general checkup with your patients?
Absolutely.
I don't think, have you, any of you been to a dermatologist? Yeah, you have, but because of a situation, right? Most likely? Yeah. See, that's really interesting. I'm hearing more and more people visiting. Lisa Kellett's going to have to come back and visit with us some more, for sure. Thank you so much for being with us today. Lots of great information. All right, thank you, Lisa Kellett. So we're going to say goodbye to her. We'll be right back. We covered a lot.